Hello everyone. In this video, we are going to discuss about the pharmacology. It's part 3, route of drug administration. Okay, let's go into the topic. The factors for the governing choice of route of administration. It is a physical, chemical properties of drug. It has a solid, liquid, gas, solubility and stability, pH and latency. Okay, it is a localized and approachable or generalized and not approachable. Okay, the rate and extent of absorption of the drug from different routes. Okay, and effect of digestive juices and first pass metabolism on the drug and desired rate of onset of action. That is the route treatment. What is the treatment or emergency routine treatment, and accuracy of dosage in IV and inhalational routes can provide fine tuning of doses. Okay, and the condition of the patient is unconscious or is vomiting. Okay, then coming to the types of routes of drug administration, there are two types: local, systemic. In local, there are topical and deep. In systemic, there is eternal, parenteral, enteral, parenteral, and others. Okay, coming to the local route, uh, first one topic. Okay, local route. These are for the localized lesions. Okay, at accessible site. One for the localized lesions at accessible site without exposing to the rest of the body. This is only for the localized lesions. Okay, and example diclofenac gel for applied for the painful knee joint. And then topical. Okay, in topical, it is external application of drug on to surface. Okay, it is more convenient and efficacy delivered to localized lesions, and it is in the form of lotion, ointment, cream, spray or drops, and it is a non-absorbable drugs given orally for action. Example GM, gastrointestinal mucosa, sucralfate and vancomycin. These drugs are given, and inhalation of drugs for the action of bronchi. Example salbutamol. And coming to the deeper tissues, by using syringe and needle, we give to the deeper tissues. The drugs, it is systemic absorption is slow, and for leg intra-articular injection, hydrocortisone state is given in a knee joint. Okay, for the leg, intra-articular injection is given. For the knee joint, that is hydrocortisone state. Okay, and then arterial supply, it is a close intra-arterial injection used for the contrast media in angiography. This is not that much important. Coming to the systemic routes, in systemic route, it is absorbed into the blood stream and distribute all over the body, all over, and including the site of action through circulation. That means it will goes to the site of action through the circulation. Okay, first one, oral route. It is the oldest and commonest we use every time orally, maximum by taking tablets, and it is more convenient, safer, painless, and non-invasive, cheaper. And both solid and liquid dosage forms will be there. Tonics and tonic and tablets, syrups, and can be given. These are limitations of oral route administration. Action of drug is slower, and that is not suitable for emergency. It cannot be used in the emergency situations, and it cannot be used for the uncooperative and unconscious patients or vomiting patient. Okay, and these may cause nausea and vomiting. Absorption of drug may variable and erratic. certain drugs are not absorbed. And then chances of food drug and drug interactions in stomach by taking orally. And coming to the second type, sublingual or buccal. In this type, the tablet is placed under the tongue or crushed in the mouth and spread over the buccal mucosa. Okay, it is only lipid soluble and non-irritating drugs can administer. Okay, in this type, in sublingual, there will be rapid action in minutes, and there in some inconvenience they can spit the drug, then the action of the drug will be decreases. And this advantages are quick onset of action and bypasses first pass metabolism of liver, and it is self administered. They can take on their individually, and action can be terminated by just spitting the tablet. uh, the action will be declined. There will be no action of the drug if they spit the tablet in the middle. Okay, third one, rectal. It is irritant and unpleasant drugs can put into the rectum. If he is irritant and unpleasant, then they will put into the rectum those drugs. uh, this method is used when the patient is vomiting or unconscious. Okay, and it is inconvenient and embarrassing. Some people will feel embarrassed when this, what is this type, what are they doing, like that. And in this route, the absorption will be slow and irregular. For example, tablets, drugs like diazepam, paracetamol, ergotamine, and few other drugs, sometimes given orally, rectally, not orally, sorry, rectally. And continue. And fourth one, cutaneous. In this, highly lipid soluble drugs can apply to skin for slow and prolonged absorption, for ointment, cream, like that. And in this, liver is bypassed. And then coming to the transdermal therapeutic systems, the drugs are delivered concentrate. If we apply to the our skin thoroughly, then the concentrate, okay, it will delivered at the constant rate into the systemic circulation via stratum corneum. The drug is delivered at the constant and predictable rate, irrespective of application of site of application. Better patient compliance. They can apply easily, and there will be first person metabolism, and convenient and self-administered. They can do by themselves, and action can be terminated by just removing the patch. They can remove in the middle, or they can rub, or they can wash or anything. And then provides constant rate of drug release and milder systemic adverse effects. There will be no that much adverse effects by using a transdermal type. Okay, disadvantages, there it is expensive ointment, and itching, dermatitis, and sensitization. And children who may unwittingly apply, they cannot know that they will improperly apply the ointment, and they can cause some actions. Okay, allergies like that, those reactions will cause. Okay, then fifth one, inhalation. In this, the volatile liquids and gases are given for systemic action. Mostly general anesthetics were given. Morphine, for example, morphine is given as the in a gaseous state to the patient for the nasal septal operation or any operation. And this, the alveoli will rapidly absorb, the surface of alveoli will rapidly absorb. Okay, and it can cause irritant vapor, can cause inflammation of respiratory tract and increase secretion. Okay, this can cause the respiratory tract inflammation. Okay, this is the inhalation route. Coming to the nasal. In nasal, the mucous membrane of nose can absorb many drugs readily. They can absorb many drugs, like for example GnRH, agonists, calcitonin and desmopressin applied or as a spray, and nebulizer solutions used by this route. Okay. Irritation and atrophy of nasal mucosa may occur. Sometimes irritation will occur, and atrophy of nasal mucosa may occur due to repeated use. By the repeated use. Okay. Coming to the parenteral, it is administered by the injection. Okay. Administered by injection. Drug directly into the tissue fluid or bloodstream, like blood vessels, nerves, arteries, like this, like the they will give the injection, administer without having crossed the enteral mucosa. Subcutaneous deposits of the loose subcutaneous tissue, richly separated by the nerves. The nerves. Drugs Drugs are deposited in loose subcutaneous tissue, richly supplied by the nerves. These are less vascular and a small volume can injected. Self-injection is possible, but not there should be not deep penetration. No deep penetration, not needed. Okay, and this should be avoided in the shock patients who are vasoconstricted. Okay, who are vasoconstricted, and in this absorption will be delayed. Okay, coming to the intramuscular, inject in the large skeletal muscles like deltoid, triceps, gluteus maximus, rectus, femoris, etc. We will normally injected in the regions in the deltoid region, gluteus maximus region. Okay, these are like richly supplied by the sensory nerves, sciatic nerves. Okay, and it is less painful compared to the other muscles. Okay, deep penetration is needed and avoided in anticoagulated treated patient. These can produce local hematoma. Local hematoma will be produced in the if we give an injection, intravascular injection is given to the anticoagulated treated patient. This can produce the local hematoma. And advantages of parenteral routes. And this is the fast onset of action. Useful in emergencies. Can be useful in patient who is unconscious, uncooperative, and vomiting or diarrhea. First pass metabolism is avoided, and no destruction of drug by digested juices, and there will be no chance of food drug interactions. This can be also given when the not orally absorbed drugs will be there by the intramuscular injection they can be given. And there are some disadvantages of parenteral routes. The drugs need to be sterilized, require aseptic precautions, invasive and painful, and a trained person should be there for the administration, and added cost of sterilization and injection. These can also cause local irritation and tissue injury. Third one, intravenous. Intravenous injection are injected as a bolus or infused slowly through saline over hours through the first superficial to the one of superficial veins and reach directly into the bloodstream. Only aqueous solution will be given injected, and these can cause air embolism. There will be chances, not high, but there are some chances. This is most risky route for the vital organs like high heart, brain, etc. And they got exposed to the high concentration of the drugs. Advantages of intravenous route: faster onset of action, useful in emergency, and bioavailability is 100%. Okay, administration can irritant drugs can be administered. Infusion given infusion to maintain steady state concentration. Okay, and then last, intradermal injection. It is injected in the skin, BCG vaccine, or scaring or multiple puncture. of epidermis through drop of drug is done. This is intradermal is used for the only specific purposes only. Okay, this is our routes of drug administration topic, and thank you for watching.